Hello, everyone. Today we're going to be talking about communication, specifically touch as a form of communication. When I do reference a textbook, it will be the Mosby's Fundamentals of Therapeutic Massage. We are using the 8th edition. Right, before we delve into touch as a form of communication, we should probably give the definition of communication, which is the act of exchanging thoughts, feelings, and behavior. And surprisingly, a lot of ethical and professional dilemmas result simply because we failed to communicate correctly. Now, touch is an extremely powerful mode of communication, and the intent of professional touch might be influenced by factors like countertransference, the thought process of the therapist at the moment of the touch. What does this mean? This means, like, if you are thinking about a fight you may have had with a family member or a friend, your touch may become distant as you are distracted from what you are doing with your client. If you are angry with your client for being late or something that you misinterpreted that they said, your pressure might be a little bit deeper, your cadence might be a little bit choppy or quicker. All of our moods and emotions are conveyed, sometimes subconsciously, through our touch, but our client can pick up on those emotions or mood through the way that we are touching them. All right, now let's touch on the science of touch. Now, we cover this much more deeply in the integumentary system class, but just as a brief overview, anatomically and physiologically, touch is the collection of tactile sensations that arise from sensory stimulation, primarily of the skin, but also of deeper structures of the body, such as the muscles, associated connective tissue, your sensory receptors, your sensory neurons, your corpuscles, and various other things. All right. There are cutaneous mechanoreceptors, usually located in the dermis, but in different layers, where they detect a wide range of mechanical stimuli, including like brush, stretch, vibration, movement of hair, pressure, and there are even thermoreceptors. All right. So, touch response involves a very precise coding of the mechanical information that is then interpreted by the sensory neurons as they send it back up into the central nervous system, okay, for it to sort of say, hey, what is this touch doing to me? What is happening with this? Now, the autonomic nervous system, which regulates visceral and chemical homeostasis of the body, responds to the skin stimulation in support of well-being of the body. All right, mood, which I just talked about, is often reflected in the skin, not just in how we're touching someone and how they feel it, but in our skin itself. Okay, we blush when we're embarrassed. We might get pale as the blood drains from us when we feel fearful about something. All of these things are conveyed in the skin, and we feel things through the skin as well. And we touch on this a little bit more as well in the integumentary system class, but we need to be touched to survive. There's a ton of mechanisms and neurotransmitters that really don't start activating until we are in close proximity to or touching our fellow social animals, human beings. So, one really cool person that's done a lot of scientific study in the field of touch research is Dr. Tiffany Field. I refer to her work quite a bit in all of my classes, but you can check her stuff out in the massage archives at the Touch Research Institute at the University of Miami, Miami's Miller School of Medicine. She has done a lot of research into how touch supports the well-being of a variety of pathologies, as well as the increase in very, very necessary neurotransmitters, and how wasting can occur with the lack of touch. Nothing really compares to the actual experience of touch, which we call palpation and massage, but you're going to learn how to do a proper intake. You're going to listen to the client, their medical history. You're going to look at them when you do a postural assessment, a gait assessment, when they do a range of motion for you and they point to where it hurts. But it's not until you touch them and you start to palpate and you understand, yes, I can feel the increased tonicity in this area of the muscle belly versus like this area. And the client can also sense when you are working on them if you are responding to the changes in their body appropriately, if you are relinquishing some of that pressure depth, or if you are changing your cadence depending on how their tissue responds to your touch. All right, so when you communicate through touch, it is both more powerful and more ambiguous than using speech. We're going to talk about speech communication in another lecture and how that can also be ambiguous. But verbal communication usually uses specific words with specific meanings to relay a message, unless there's a miscommunication with that. But touch communication, you are touching someone coming from your experience with touch, and they are experiencing with your touch through their past experiences of what touch meant to them. What did their cultural context of touch teach them? What did their family teach them about touch? Were they all big huggers? Did they avoid each other? What does their religion tell them about touch versus your religion or the way that you grew up? Also, each person defines an area around themselves as personal space, and this space differs from culture to culture. Here in America, we're a little bit more spaced off than where I grew up in Belgium, where it was very common, to touch the arms, shoulders, hands of the people next to you in the grocery store. Greetings were air kisses on either side of the face. You would usually never see men doing anything more than a handshake and standing a few feet apart here in America, if they were born and raised here. So there's a lot of cultural context that you need to be aware of with people's personal space, as well as how they give and receive physical touch itself. So, what is a cultural influence? So, a culture is defined by arts, beliefs, customs, institutions, any kind of product or social construct of human work created by a specific group of people at a particular time. Um, we don't want to stereotype people into a particular type of behavior ever based on the culture that they grew up in, because every person is an individual. But you do need to respect cultural beliefs that they do hold that are different than yours, and you do need to ask them questions in a respectful manner so that you can understand your client's background a little bit better, so that you do not inadvertently do something to offend them. So, another social construct as well as culture that we need to talk about is gender identity and diversity. So, biological sex is how you were born. It is your anatomical features, it is your physiological functions, it is either male, intersex, or female. However, gender identity is the way people perceive themselves, which doesn't necessarily always align to their biological sex. Now, as massage professionals, how they communicate to us with the way that they dress and with what they tell us verbally, we need to be professional and non-judgmental about, which is a constant ongoing process of self-examination. What should never be considered in a massage office is sexual orientation, which is the emotional, romantic, or sexual attraction to other people or the lack thereof. This is something that you need to keep in mind, that you should not be communicating to your clients, and you should not be asking them either, because it has absolutely no bearing on the massage whatsoever. Something that is interesting to think about, however, is when someone identifies as a particular gender, you will have a bias to touch them differently. And now we're back to touch as communication. If a client presents as female, you believe her to be biologically female, you will have a tendency to avoid musculature in the pec region that in a lot of females is covered by breast tissue, which you are told to bypass and work away from as massage therapists for the sexual connotations of it in the United States. And with a male, if they let you do it, you'll probably be working those muscles quite a bit deeper. When someone presents as female, even if you believe them to be biologically male, you need to treat them in the same way that you would as a female when you do touch communication. And you need to respect the areas that you would on that particular gender. So that's just something to keep in mind in terms of legality and in the terms of the way people feel and how they present themselves. As always, just like cultural diversity, the client is the best source of information. All right. So ask relevant and courteous questions. If you believe it is a biological male and they are presenting as female, you can ask, you can say, hey, is there scar tissue? If you believe that they have had top surgery and are skilled in that type of work, you can absolutely offer to work in these areas. But please be aware of gender context and what that could mean for you, not only legally in terms of touch, but also professionally in terms of communication. Right. So the influence of age on touch. Our age and our life experiences have a lot to do with how we perceive touch, how we feel touch is appropriate. A lot of times, people will misinterpret what touch will feel like from practitioners based on their age as well. Two people that got licensed at the same time with the same amount of experience, one might have come in fresh out of high school, the other might have come in as a second or third career choice in their 60s, and you may falsely assume that the older practitioner has more experience, even though that may not be the case. I know I personally had my own bias with a young lady I went to school with. She was, I swear, no more than 80 pounds. And I thought, well, for sure, she's not going to be able to do any type of deep pressure or deep tissue. And by using really good body mechanics and leverage, her touch without any real effort on her part could absolutely fold you in half. So, how touch is perceived and how touch actually is are sometimes two different things until it actually happens. The influence of life events absolutely changes your interpretation of touch as well. If you've undergone painful and extensive medical interventions, you might process touch differently. You might be scared of some types of touch. If you've been isolated, parents that are neglectful or maybe busy a lot of the time and you're an only child, you may not have experienced a lot of touch growing up at all and might be apprehensive to being touched now. If you've had any type of trauma and have been physically assaulted or sexually assaulted, types of touch can be very triggering for you. If you grew up with a lot of touch, big family, lots of hugging, lots of people living in a single house, you might think that it's okay to grab and hug everybody. And again, I brought up cultural context before where I grew up, everybody touched each other, gave air kisses to total strangers. It was absolutely unheard of to not be within at least 6 inches of other people. Whereas in America, it seems like people usually have a bubble of about 3 feet around each other. So please keep these things in mind because even if we appear to be the same age, possibly the same culture as somebody, that doesn't necessarily mean that their experiences with touch growing up or in any type of social construct have been the same as us. All right, so just like culture and gender, we have spirituality or religion as another social construct or individual set of developed beliefs that we have built over a lifetime of experiences. And everyone may or may not have an opinion about touch that relates to their own spirituality. Just like everything else, make sure to communicate with your client so that you are not accidentally doing something to offend them with touch and their spirituality. So, moving on from that, on any given day, at any given moment, the need, desire, interpretation, and appropriateness of touch can change. Consent can be given and taken away in a moment for any type of touch. People are in a constant state of flux in terms of responding to and adapting to encountered events. And something that's really unique in the massage environment is that the type of relationship that you build with your client and its duration of that relationship is going to influence touch. An example here is that a first-time client might not be receptive to deeper tissue, especially if the goal is relaxation. However, after they've had several relaxing sessions with you, they might be like, you know what? I think I might need deeper work in the shoulders, and because they know that it can reduce pain, maybe increase their mobility. They feel a little bit more relaxed now from these previous sessions, and they trust you a little bit more. Now they are open to that deeper work that they were previously not interested in. A client can also be ticklish to light touch initially in the session, but after getting desensitized by constant touch, especially deeper touch repetitively in the area, they may be relaxed enough that now the light touch feels pleasurable rather than ticklish now that their tissue has warmed up. So touch, influence, time duration, relationship, mood, constructs of all of our social bits of who we are, whether that's culture, religion, gender, how our families were when we grew up, our touch experiences, whether there's been trauma or not. These all influence our client's interpretation and also how we as massage therapists communicate by touching them as well. So, just to reiterate, we need to explore and challenge our biases, especially if it's an implicit bias, which is a form of bias that occurs automatically and unintentionally. All right, it affects our judgments and decisions and behaviors without us even really knowing it, which is why self reflection is absolutely so important. Now, you are required to take an implicit bias class, thank goodness, right now as a massage therapist. Please pay attention to that when you do. Please take one at least every 3 years when you recertify. Absolutely. Do the self reflection. You will learn things about yourself over time that hopefully you can self correct and have an amazingly better life for it. Another thing to notate that it is impossible to touch clients without them in turn touching us. A touch given is at the same time a touch received. You are communicating even though you may not think that you are. Your intention is being communicated. Healing touch is being communicated or not communicated, depending on your level of attention that you are giving to this client through your touch and through your thought and through your intention. All right, I used the example before that if you're thinking about a fight that you had earlier with someone else, your thought and intention is going to be focused on that conflict and not on very directed intentional touch on your client. All right. They are feeling that, they are receiving that, they are also responding to you. Another way that you communicate through touch with your clients back and forth is with chemical messengers, which we'll talk about in just a little bit. When you are touched, that sensation is received by your sensory neurons, by your corpuscles, by your mechanoreceptors. All of that information is sent into the body and internalized. All right. Professional touch is not meant to be an act of exerting power and dominance over your client. But because of the difference in power base, which we talked about, your power differential, you need to consider it. All right. You need to consider how you are touching them, the appropriateness of how you are touching them, and careful attention needs to be paid during this professional touch to manage the issue of power and dominance ethically. You are only touching the client in the ways that they have given permission to in informed consent. You are not surprising them with other forms of touch. You are not doing things to them or touching them in ways that they mentioned they would not like, even though you think it is better for them. If they requested only light pressure relaxation, you do not dive into deeper work because you think they need it in an area. Now, there are several forms of inappropriate touch that you do need to be aware of. The very first one is going to be hostile or aggressive touch. This occurs when the potential for conflict or a power struggle exists. All right, the perception is that one holds power over another, and maybe they're unhappy about it. This might not necessarily happen so much in the massage therapist client setting, even though there is this power differential. However, it might be in the setting of the classroom. Maybe one of your teachers has made you upset. Maybe you're angry about something, and now they're giving a massage demonstration, and you absolutely don't want them to touch you, but you don't want to get a bad grade. You're going to feel that there is not only an emotional conflict, but a power struggle in this particular dynamic. All right. In the case of a massage therapy office, knowledge is power, and the professional usually knows more about the service than what the client does, which is why they are in the position of power. If you are angry with a client, you should not touch them because that feeling could be conveyed. And if the client is angry with you, you should not be touching them until their emotions also change. All right. During the massage, we need to sustain a focus on how and where the client's body is being touched and the client's perception of touch. If you become distracted, like my example of an earlier conflict, with a boyfriend or family member or girlfriend, you are not paying attention 100% to that client's body and intentional touch. There are other things to be aware of in the massage environment, and that is things that could influence the perception of massage, like loud noises if there's a client next door talking loudly to the therapist in a shared space, or if you are in a massage office in like a dirty strip mall that seems to be unsafe and there's constant sounds of ambulances going by if you're near a hospital, or if there's any type of arguments, or even if you are gossiping to your client. This is going to be distracting and create a hostile environment if this is not something that they wanted to engage in with you. All right, another form of inappropriate touch, which we talked about quite a bit in sexual misconduct lecture, is going to be erotic or sexual touch. We cannot touch people without eliciting some type of pleasure because there are physiological and mental aspects that influence not only the client but the therapist. And we're going to talk about those body chemicals like oxytocin that kick in that influence pleasure moods and feelings of connectedness during that massage. You need to constantly pay attention to the understanding and interpretation of any type of feelings so that there's no transference or countertransference occurring, so that pleasurable touch does not evolve into or become misinterpreted as erotic touch. All right. When we talk about the history of massage, we learn that the Christian church banned massage for hundreds of years because it was deemed pleasurable, and that was not acceptable. Uh, we don't want to go back to the dark ages of banning pleasure, but we need to make sure that pleasure is not interpreted as erotic by the client or the massage therapist. All right. A lot of times people are touch starved. We've talked about this before, and they may only interpret good feelings through touch, which is usually sexual touch, and it is very easy for them to confuse massage therapy with romantic intention from the massage practitioner. So please be careful with that. It is inappropriate and illegal for you to have any type of erotic um, interaction with a client either in or outside of the massage environment. You cannot date your clientele. You cannot have sexual encounters with your clientele. Remember, if they ask you on the NBLEX, you need to wait a minimum of 6 months is the recommendation before starting any type of relationship with a previous client. Right, another thing to consider is going to be invasive touch. Invasive touch can be intentional or unintentional. As a massage professional, you are the one responsible for understanding all personal and cultural rules when it comes to when and where to touch your clients. Different areas of the body also reflect different tactile issues. Some areas of the body are considered erogenous zones and they have many nerve endings and are much more sensitive when touched. Now, the largest distribution is going to be in the genitals, the breasts, the nipples, the lips, the mouth, the tongue, the buttocks, and the inner thighs. But this can also apply to areas that just aren't touched very commonly, like the inside of the wrist, the armpits, the anterior throat or neck. All right, these might be much more sensitive areas. Orifices, if it is an opening to the body, please don't touch it for a variety of reasons. These are usually the anus, genitals, but also is the mouth, ears, and nose. We don't want to get any bacteria going down into that ear canal. We don't want to massage the inside of someone's nostril and get MRSA. Thank you, no. There are cases of doing work inside of the mouth, but this is few and far between, and usually a specialization that you would get into. So please avoid that in general as well. Of course, the outside of the ears, outside of the nose, and around the mouth and facial massages are perfectly fine, but never in an orifice. The ventral part of the body, which is the front part of the body, is usually much more sensitive than the dorsal side, which is the back. And usually when our clients are lying prone, they feel nice and protected because we are working on the back, which is less sensitive, and that front of the body is protected as they sink into that massage table. But when they lay supine, when they are to be worked on, because as we know, if the back is tight, then the front is probably loose. And if the upper back is loose, like the rhomboids, well, then the pecs are probably tight, like in rounded shoulders. So then what do? Please be careful, because working on the ventral side of the body is going to elicit more feelings of vulnerability in your client, not only in skin sensation, but emotionally as well. Now, the book states that often the least intrusive form of touch is laying a hand on a person's upper back near the shoulder. However, if they've been assaulted or especially attacked from behind before, this could be extremely invasive for them, especially if you're just reaching out and touching them there without warning or asking them first. So please be aware of that. Children are often touched on the head or face as older adults grab at them without usually asking for consent first, or if parents are reaching out to hug their children's faces to give them a kiss. But usually adults don't touch each other on the face because they respond very emotionally to this. You need to always ask permission before touching someone's head. They may not want their hair disturbed, any lotion or oil in their hair. They may be sensitive. Some people love scalp massage. Other people feel very apprehensive about it. You always need to get informed consent, even if it's a perceived area that is safe to touch. Also be aware of anyone, not just of having trauma from an assault or a car wreck, but if they've had surgery in an area, even if that surgical area has healed, it can have an emotional attachment to it, and your client does not want that area disturbed. We also, of course, have appropriate touch, or we wouldn't be massage therapists. And there are some non therapeutic ways that happens to people. This could be inadvertent, such as you accidentally bumping into someone, or socially stereotyped touch, or highly ritualized touch, such as a handshake in the United States, the air kiss or the hug in other countries, or a lack of touch, just a small bow and a smile because you don't want to shake hands and touch someone else's bacteria in other countries, okay? So these are ways that we can touch people. Your book again says appropriate touch could be touching a client's shoulder to direct them to the massage room. I suggest not doing that. After COVID, we have stopped a lot of this inadvertent touch. But also, unless you have already had that intake and know your client well, this may be a trigger area for them, or they may be coming to you for a specific reason, but do not want any extra touch whatsoever. So I would err on the side of caution and not do the extra touching until you know your client well enough to know that it will be well received. Now, of course, there are hundreds of touch techniques. This is the basis of our therapeutic massage methods. Now, we're not going to cover things like effleurage, ringing, kneading, petrissage, and things of that in this lecture, but we will emphasize that touch is the tool for massage. All right, we use various forms of it to achieve specific outcomes. And the intention of our touch can be classified in two ways. All right, we either communicate through mechanical touch, which is used to achieve a specific anatomical or physiological outcome, like we are wanting to use massage to increase the range of motion in the shoulder, or maybe decrease the level of pain in an area of hypertonicity in the back. There's also expressive touch, which is used to support and convey awareness and empathy for the client as a whole person. So maybe they've had a really rough week at work and they've come for a relaxation massage. They are looking for more emotional, expressive touch. The professional's intention influences the interpretation of touch. Whether you believe that your touch can be influenced by your intention or not, it very physically does differ in how you touch your client. A client with a mechanical restriction in the shoulder might find a more expressive form of touch uncomfortable because it feels too intimate. They don't want soft, smooth, going over the whole area and encompassing it. They don't want that. They want that directed work into that tighter muscle. Stressed and overworked clients might find a mechanical approach distant and impersonal because they want that empathy and understanding along with their physical changes. So they are looking for those all-encompassing relaxation techniques. All right, so as we're developing as professionals, obviously we need to develop both forms of these, all right? Mechanical touch skills increase as we learn anatomy and physiology and how we are going to do these specific techniques of like petrissage, kneading, ringing, etc., etc. Development of the expressive form of touch is more complex and involves the professional's personal growth, interpersonal and communication skills, understanding of your own life experiences and how you interpret touch, and how you can express empathy for your clients. All right, massage professionals serve others by providing physical touch. So you need to really invest in learning how expansive the experience of touch is. So we're going to cover some definitions, starting with quality of touch. So examples of this could be, is it cool? Is it warm? Is it soft? Is it wet? Is it moist? Is it dry? Is it confident? Is our massage therapist shaking a little bit when they touch us? Or is it a firm, warm touch? All right. What depth is the touch? Therapeutic intention is the focus on the client. Are we client-centered and goal-oriented in what we are doing? Are we exacting in our touch to work on our client's goals? Pacing and leading is the idea that you begin your session sort of at the speed and the readiness of the client's body and their breathing, and you slowly lead them toward their outcomes that they wanted by altering the speed and rhythm of the massage as well as their breathing. Rhythm is the application of massage methods in the idea that strokes should be applied in regular patterns at a regular pace to elicit the parasympathetic nervous system response, all right? That repetition, 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 that can get us into that altered state of consciousness that we talk about in another class. Strokes delivered in an uneven pattern, all right, if we're jostling them, shaking them around at an irregular pace, they're very jarring for the nervous system and the client has difficulty relaxing. Now, these jostling, jarring techniques are pretty good with things like sports events or massages that we want to elicit some type of wakefulness in the client. Otherwise, we definitely want to look for this soothing repetition to put this client at ease and elicit that parasympathetic nervous system response. Engaging the tissue. All right. We have clear communication about the goals the client has. We can feel what the tissue needs, and we come up with a satisfactory compromise to get that client to their goal while working with the body in the way that it needs. The therapeutic edge, this is the pace, depth, and intensity for a specific client that allows for achieving those outcomes. Flow and continuity is the idea that methods flow from one technique to another, from one body area to another through smooth transitions. Like we finish with the lower leg, introduce the knee joint before moving up to the upper leg. All right, stroke length in massage and bodywork sessions is just how long are we going? Are we traveling the full length of the muscle and muscle groups, which we should always do when possible, so that we are working the entire area for a relaxing and complete working of an area rather than leaving them jarred and feeling half finished. All right, general versus specific work. This is the idea that broad and general application methods sort of begin, soften, and warm the tissue. These are our long effleurage strokes. We're warming up everything in the area, leading to more specific work, whether that's some neuromuscular or some trigger point therapy. And then we go back to general and make nice with the area. One important thing to make sure of is that resistant tissue is not forced. We are not going to just jam our finger down or go straight into deep compression. We're going to slow down and wait for the tissue to deform. A lot of therapists call this the melting. We're going to make sure that the muscle or tissue melts beneath our hand by making sure it's warmed up sufficiently, by finding that therapeutic edge and then working in layers. The felt sense is pretty interesting. This is an internal somatic knowing. It's difficult to express using words. This might be a visceral feeling a client has or how you feel their body, and it's difficult describing the full grape-like quality of a ganglion cyst underneath your hand. Sequencing refers to the sequence of the strokes, which is the order that they are applied into a particular body area, and to the overall sequence of the massage. All right. We don't want to do the feet and then immediately go up to the face for pathological reasons, right? We don't want to be spreading those germs, but also for reasons that we want to have this continuous flow over the body. Transitioning, we want to be smooth and enjoyable movement. Like I said earlier, working from the lower leg, we want to introduce the knee joint before we then move up to the upper leg. We always want to make sure that we are using variety in this massage and bodywork application. Different muscles respond in different areas to different methods better than others. And if you are being overly repetitive, your client might find the entire thing boring and not want to return. There's also the use of breath work during sessions to benefit the client. We talk about this a lot in our respiratory section of our anatomy class, but please make sure that you are educating yourself on not only breathing properly as a massage therapist, but how to make breathing recommendations to your client as well. All right, on a final note, we need to make sure that we are communicating very clearly about your client's perception about massage therapy and what they are requesting. Their version of deep tissue may be very different than yours. They may have seen another therapist for the last 10 years, and that therapist's version of Swedish might be different than your version of what you are doing for a client when they request a Swedish. Make sure that you are in constant communication about how the client is perceiving your touch versus what they have requested to make sure that they are satisfied and that you are reaching client goals. Another thing to keep in mind, and we're going to talk about this in another lecture, is being trauma informed, okay? Make sure that you are treating every client as if they may have had a potential trauma, and we are always providing a safe space, both physically as well as emotionally and psychologically for our clients. We're going to pay constant attention to how that client perceives our communication and our touch, as well as creating awareness, creating a safe space for them, and remaining sensitive to their needs. All right, guys, I will see you on the next one.